Unique New York.
The arsonist had oddly shaped feet.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. J. Dudum. This is Back at It with Dr. Decompression. Welcome. I'm Dr. Dudum. This is the Back at It with Dr. Decompression. We got episode 10. I'm here with Dr. Russell Teams, good friend, has a private practice in Arizona, Scottsdale, Arizona, right?
Phoenix, Arizona. Yep.
Phoenix, Arizona. Today's episode, I want to thank our sponsor, is brought to us by Pillowise USA. Thank you, Pillowise, for your support. And let's jump into the podcast. Dr. Russell Teams, welcome. We finally got you on here.
Thanks for having me, Dr. Dudum. Happy to be here.
We're excited. Dr. Teams is a chiropractor, but also a functional neurologist. And he specializes in neurology cases and spinal decompression cases, correct?
Correct.
Doc, introduce yourself. Tell us where you went to school, what you do, who you help. Why do you do what you do?
You bet. I ended up getting into chiropractic because I myself had back pain, right? So I had some injuries, I had some fractures in my spine, resulting disc issues from a pretty young age. We didn't really know about disc issues when I was 18, 19. So, fast forward about 10 years and I'm finishing up chiropractic school, and not only is adjusting helping, but the neurology-based adjusting and therapies actually helped me mostly. So they actually pretty much cleared out most of my orthopedic issues, pain-related issues, and still had problems from time to time. And that's actually where I found decompression, was down the road. Started using that myself, healing up my own issues. Wasn't anything super severe, but I saw the value in it and how many other people have tenfold what I had going on, and just knowing I had another tool to help them. So I went to school in the Bay Area, a little place called Life Chiropractic College West. Have you heard of it? Hayward College.
I have heard of it.
Okay, I graduated 2009. So I've been practicing chiropractic neurology since then. I'm sorry, 2012. Chiropractic neurology since then, but have been involved in neurology since 2010.
Okay. I graduated in 2011.
Oh, what?
Yeah.
Did I see you there? Cool.
Yeah, we might have overlapped in a few classes
Might
there.
have overlapped a few times, huh?
And done a few pool tournaments in the break room,
Ping pong.
Ping pong.
Uh-huh.
Yeah. Few golf tournaments. Tell us with the decompression, what kind of patients are you seeing?
Seeing, honestly, all ages, all sizes, all severities. I've got people ranging from just a chronic small disc bulge that's usually just right across the low back into like the upper hips.
Yeah.
And they're tired of dealing with pain. Help those folks out really, really well, and usually fairly quickly. And then you have the more severe cases that are calling me with a surgery date in 3 weeks.
Wow.
And they have tried everything. They've tried other decompression clinics. They've tried neurology, acupuncture, PT, you name it, injections. My only answer to them question is, would you please just give me the opportunity to help, because you haven't tried everything yet. And I think, you and I have talked a lot about the tables that we use, specifically the dock table, which seems to be honestly the game changer in terms of all of these people's care, because they've been everywhere before. And I'm sure you see the same stuff.
Yeah. Big game changer. How long have you had your tables? You've been doing this for a few years.
So we had other tables first. We won't say, but
no, we'll keep it out. We'll keep it clean.
The results were very hit and miss, not very consistent. And I wanted more consistency with my care, with our outcomes for our patients. And so on your recommendation, I started with that dock table a little over a year ago. And now we have 2 with a third on the way. So
3 tables?
3 tables on the way. Yep. And so they're full the majority of the day, helping people with disc injuries, spinal stenosis, foraminal stenosis, neuropathy, facet syndrome, pain, you name it. We're seeing it.
Everything. So you're gonna When's your third table come?
Should be in the next 4 to 5 weeks.
Okay.
Mhm.
That means you're going to be able to help more people cancel their spinal surgeries and injections.
That's exactly it.
Yeah. When did that's so cool. When did you tried decompression? You didn't have you weren't like severe pain, but you had a disc, you had something going on and it helped you. When was that? When did you first try it?
So my story was actually goes way back to, say, middle school. I actually suffered a traumatic spondy, broke some bones in my spine, my pedicle lamina junction, bilateral. And so at the time we didn't have health insurance, so I had to go through this in a natural way. I tried to go through PT, but ultimately had to do it myself. They wanted to brace me from the bottom of my rib cage to basically the top of my pelvis in like a hard brace. Luckily, insurance didn't cover that, or we didn't have it, and so I had to go the natural route. Dealt with low back issues all the way through chiropractic school. You know, as a competitive golfer, I was constantly playing at the time, and just flaring up my low back. I mean, every day, every week, it was tough. And when we go through some traction or some of these older tables, you know, they provided a little relief, but I mean, just putting the right amount of pull with the right positioning at the right time with these dock tables were game changers for me. They allowed me to go all day, no issues. If I ever have any hiccups, like I call them, usually just 1 or 2 little sessions gets me right back online.
So you had tried traction, you've tried other tables, not just for patients, but for your own issues.
My own issues. Yep.
And you noticed a big change with the dock table versus these other tables.
Like that. It's night and day difference.
Wow. I've only used the dock table. That's what I started with.
Yeah.
I don't know the difference, only from patients that have come in that haven't gotten the results that we've talked about.
Yeah. So the common table that I have seen over the course of my career is usually a blue table with the both ends come up. It's white underneath, and it's got a rope that has a little clip on it, and it seems very non-specific. You just kind of guess and hope that just this type of motion is going to help. But you know, with our new tables, we can literally pre-program any position, figure out the most comfortable position on the y-axis, the x-axis, whatever that patient needs. And that was the difference in the one patient I told you, described earlier, to keep them out of spine surgery.
Are they not having spine surgery? They canceled it.
Yeah. So I just saw her last week. We're getting ready to run a follow-up MRI. So I'll be happy to cast again and share those results. But she came to me with 3 weeks. This is when I first opened my new clinic. I was answering the phones. I was treating the patients. I was doing the accounting. I was cleaning up everything.
Been there.
And I answer the phone and I pretend like I'm not me, right? I use my secret name, my office name.
What's your office name?
Just Russ, right? Nobody knows it's Russ.
Okay.
So I went in as Russ, like, hey, thanks for calling Desert Brain and Spine. And the next thing I know, we start getting into the story with the patient. And so I had to break down and say, all right, I got to admit, this is Dr. Teams. Like, let's just talk now. And so she had 3 weeks to her surgery. Her prelim, her pre-op was 1 week prior to that. So I had 2 weeks to figure that out. And what we did was we saw her every single day. We had to very specifically rotate the table, flex the table. She had a right lateral recess herniation that was a monster.
How big?
I can't remember this. I can't remember. Probably 1.2 millimeters.
Wow. So
pretty much covered up the entire lateral recess of her L5. And so we ended up, just talked to her, said, hey, just come in, let me check it out. Let's last ditch effort. What do you got to lose? You can get surgery if it doesn't work, right? Like I said, she'd already tried everything. I saw her every day for the first 2 weeks. After the first 2 weeks, her pain was about 40% reduced, and she had pushed back her surgery from November until February.
Okay.
This was last year. And by December, she was basically completely out of pain, and just barely tingling into her leg at that time. So it was about 8 weeks in, and she was probably 90%. So we spent the remainder of the next, say, 2 months rehabbing the nerve itself, and then rehabbing her spine muscles, exercising, stretching, just slowly returning her back to full function. And now I'm happy to say that she was able to finally book a trip to Disneyland with her kids and her husband. It was the first vacation they were able to take in like 2 to 3 years because of her pain. And she came back and was like, I had the best time. My back doesn't hurt at all. And so she's just doing amazing.
That's awesome. What an amazing story.
Yeah, it's a pretty cool story. I love that one.
Wow. Do you have any others like that? What's another one? Obviously, that resonates with you. What's another one?
Yeah, I've got one right now. He is about a 40-year-old flamenco dancer. Okay. Not only does he do the dancing, but he helps the whole production of the show. So he sets up the show, the stage, the lighting, the walls, you name it. He sets all that up. So he kind of like runs this production. And so when he came to see me, he wasn't working anymore on that. He would show up, but he couldn't do anything. He had, oh gosh, he had a protrusion of probably like 7 or 8 millimeters, dead center of the spine, where they can't bend over long, they can't stand up long, they can't sit long, they can't walk long. They lift anything of any weight with, if they look at something wrong and their back goes out. And so that was this individual, and he'd been a professional flamenco dancer when this happened. So he had to stop dancing professionally. And so we're just finishing up he's probably on week 9 right now, due to a little vacation in there for a week. But I mean, he's back to dancing, setting up stages, scheduling more shows than he usually schedules because he's feeling so good.
These are amazing results. Dr. Teams, if someone's listening and they live in the Arizona area, in the Phoenix area, and they want to come see you, they want to follow you, how do they get in touch with you?
Oh, that one's easy. www.desertbrainandspine.com. Spell the whole thing out. I work with a wonderful video editor. His name is, we'll call him JC. He will help me out. He'll throw something on the screen here. The phone number is 480-674-9199. You can either submit an inquiry through the website or just give the office a call. My staff will probably text you back and get you started on the process for a consultation and evaluation.
Awesome. So if you're in the area, you're listening to this, you have a family member or a friend that's trying to get relief, and you're in the Arizona area, contact Desert Brain and Spine. You'll see the link. If you're listening, desertbrainandspine.com. Awesome. For people that are watching or listening and they haven't been to either of our offices, they're wondering, you said an 8-week program. What does that look like? What are they doing every visit? I know, but tell the listeners kind of what they're getting.
Of course. So my office being a chiro neuro office, just in a simple way, everybody gets a neurological evaluation to see what you need, right? In my eyes, everybody can use strengthening, just like we could all benefit from the gym. Yeah. This is kind of like a brain gym. And so consider me the personal trainer for the brain, so I can give exercises, usually spine cases as they come in for pain. Then we run them through the eval. I identify any breakdown in any of their neurological structures that really pertain to the strength of the spine, right? So our cerebellum and vestibular system, which means our eyes, our head, and just general movement patterns, all of that impacts the stability of our spine. So for me, I have to give some form of therapy, whether it's ocular motor, head-based, body-based, breathing-based, to deal with those stress pathways that flare up these disc issues, vagal nerve stimulation, any of that. They can take all of this home for exercise. But depending on the severity, if it's really acute, I'll see them every day, usually for about 2 weeks, which is about 4 visits in a week, and then we peel that back to 3, 3, 3, and 2, and 1. And then depending on how bad the problem was to start with, we usually suggest a maintenance-based program that is very infrequent, once a month, but it's based on the individual. So I'd say about 50% of the cases that I work with end up on a maintenance program, but so far that's kept them almost pain-free the entire year when they're used to 4, 5, 6 flare-ups that take them down for a week at a time.
Wow. That's amazing.
Yeah. Are you asking about what we're doing like in each visit, or what does the program typically entail?
I think that was great. That gave the listeners an idea of what you're doing, how you're analyzing, and then maybe walk through specifically the services that you're doing. Like, do you do muscle stim? Do you use cold lasers? Like, walk us through and educate the listeners on all the maybe the technologies too that you're using.
You bet. If you were a new patient, right, sitting in front of me, I would say, hey, over here is your MRI. We've got, let's say, a herniated disc or a protrusion at L4, L5. It's about a centimeter. You know that this is a serious problem. It's keeping you from doing XYZ with your family. And what I'm going to try to do for you is, number one, I'm going to put you on a decompression treatment program. That's going to allow the disc to actually go through rehabilitation as opposed to everything around it. And so the disc starts to actually get this, what we call imbibition, but it's basically a pumping effect, gets nutrients, blood flow, oxygenation, and it helps the disc heal, right? Okay. So the body's designed to heal. It's not designed to feel good all the time. We're just trying to help this healing process get kickstarted. On top of that, you do your neuro program that helps to stabilize all the muscles connecting to that area. And then each visit when you're in, I use what's called H-wave for pain. And then I use that as a send home procedure for rehabilitation to the spine. So it kind of what it does is bridges the gap between lack of movement where you have been. The electrical stim activates this rehab center, creates what's called angiogenesis, so new blood vessels, and it basically gives muscle exercise as opposed to just muscle stimulation, which is pretty typical of those, what I'd say, the inexpensive units out there. Yeah. And so this starts the rehab process, and then people can literally start to exercise as that bridges the gap for them. Wow. And so that's actually a home-based treatment program that we rent out with the program. And then every visit that they're in, we use we use lasers to decrease inflammation, increase blood flow, and just overall promote cell regenerative changes, along with what's called PEMF. It's kind of based on the case, depends on how much inflammation is present, but the PEMF I use more for the neuro cases, for brain and vagal nerve stimulation. And then if the patient is super stressed out, they all get vagal nerve stimulation. So what is
vagal nerve stimulation? What is that?
Stimulation is our rest and digest like super pathway. So it comes out of our brain or our brain stem, travels down the front of our neck into our visceral area or abdomen. And it basically creates all the resting and digesting motors to be activated, which means enzyme production so you can break down food, stomach acid so you can break down food and protect yourself from critters on the outside world. It creates motility, so it helps reduce things like constipation and helps improve absorption and things like that. So you can get healthier while your spine is getting healthier. So that's kind of how I work with that. And then you use the power plate? Of course we use the power plate. So you're getting ahead of me. So the first half of the program is really getting people out of pain. My goal is a 50% pain reduction, and that's when I start working out. As soon as somebody reports 50%, we start exercises that visit. And so we start with core-based exercises, usually things like, we'll say a plank, a bird dog, maybe single leg type stances for cerebellar rehabilitation. And then we have them go through a squat, cross crawl, lunge type of treatment program on the power plate thereafter. So we graduate from more of that acute inflammatory cascade with lasers and electrical stim, and we go straight over here to the rehab, which continues to involve the table and then makes their body work to heal their own spine. Yeah. And 50% reduction, then you're hitting the power plate, less pain, you're hitting the stabilizers. Yep. Okay. That's awesome. 3 tables coming. 3 tables. One's coming. Any more square footage, any expansion coming on there? You helping more people? Give the listeners a little, tell them what you're doing. You bet. So we opened our office January 2023, and it's been basically about to bust at the seams. since the summer completed. People are coming in like crazy with spine related issues that they dealt with over summer break, with neuro issues. Kids are in school, they're finding out that they can't focus and attend, or concussions with football, all sorts of issues. So because of that, we're looking at space next door. I just interviewed an associate doctor yesterday, and it could be promising. So growth is on the horizon. And this doctor also specializes in neurology. And so we'll get them up to speed, have them really go through all of our protocols and practices to best suit the patient's needs. And really excited to see what 2024 brings.
This guy is getting another table. How much square footage is the expansion?
1,500 square feet on top of 2,500.
This guy is getting a third table, and he's going to have a 4,000 square foot neurology and decompression clinic. You must be helping a lot of people over there in Phoenix, my man.
You know, not helping enough.
There's always more. There's one more.
There's more.
What with these disc cases, what are you typically seeing? Like, what's the most common person? Let's talk about from a neurology perspective and from a decompression perspective. Who's the most common patient you're seeing?
So what I would say is the most common age group is probably between like 35 and 50, maybe 55. Okay. You know, we both know that between 35 and 55, we've had a lifelong exposure to degenerative changes, gravity, car accidents, sports, whatever it may be. So the vast majority of the people I see that even if they have neurological issues, almost every single one has a spine issue. I just got an MRI back yesterday from a lady who could only had an X-ray that showed decreased disc space. You got a spine over there with you? Yeah. Show me a decreased disc space.
This is a great disc space. A decreased disc space would be when the space between the two bones, the disc wears out and the space actually gets smaller. So let's say this is a centimeter, the space will reduce, and let's call it half a centimeter.
So this particular person had like 2 millimeters of space between their L5 and their S1, with what I measured to be an 8 millimeter disc bulge.
Wow.
Yeah. And so, but she came in for anxiety. So she's got anxiety, stress, headaches, but she's also got low back pain. So what I'm able to do is evaluate the neurology, see if it applies to anything that she has going on. It definitely applies to her headaches as well as her spinal stability, because her balance scores are really poor. And so we are getting ready to start her on a neuro decomp program next week.
Is that common that you'll combine both? It sounds like you.
Yes, it's very common because it's very convenient. You know, a lot of people, and you've probably experienced this, they go here to this doctor for this, they go to this doctor for this, they go to this doctor for this, they go to, you know, I think with what we do, what you and I both do, is we can take care of most of these people's problems under one roof. At each visit that they come in, over a couple of short months, their problems can be essentially gone.
Wow. Amazing. You talked about the unique case of the woman that just went on her vacation with the large herniation. That's with the decompression. Walk me through an unusual case, a case that stands out in your mind, a challenge, something about working from so the audience can get an idea of a functional neurology perspective on what you did and the outcome.
That's an amazing question. I had another individual. We went through, you know, everything looked like a straight spine case, right? The neuro testing was fairly good. The history didn't indicate, or they did not let me know, that they were going through a severe stress. This particular person was getting divorced. And so they were dealing with some headaches, but they were convinced it was because their back pain was so bad. So we go through probably 6 of the 8 weeks of this decomp program, and they're doing maybe 50, 60% better. But I think both you and I typically expect a little bit better result than that. So I said, hey, like, what's going on? You know, like, talk to me here. You're not getting the results that I want you to get, even though they were like, no, that they're happy with the treatment because they just feel better overall. So we ended up really getting into it, diving in. And when I found out this individual was going through divorce, I also found out that they weren't sleeping, not because of the pain anymore, but because they were so stressed out, right? They're separated, they're living on basically off a friend's couch. And, so my job at that point became calming down the nervous system, which my guess, educated guess, I would say, was keeping the pain signals firing like crazy. Right. So we started implementing neurology based care, laser care towards the brain, and that pain level significantly reduced.
Wow.
And function and mood went through the roof. So her recovery basically ended how it should have in the first place, but we had to kind of fast track the neuro after we didn't quite know everything that was going on.
That's really cool that you were able to figure that out.
Well, the reason why is because the decomp program, these tables, they do the vast majority of the work. And when you're not getting the result that you need to in a very specific amount of time, I have to go back to the drawing board because that means I'm missing something. These tables are phenomenal. I trust them. I put my family on them. They're in once a week. And so, yeah, the whole program is fantastic. And life for me has changed since being able to help more people with these issues.
Wow. Helping yourself with the decompression tables, your family, your patients, all because of the non-surgical spinal decompression table.
That's right.
Awesome. And you're going to start doing some more pre and post MRIs where we're talking about.
Yep. I've got 3 out right now. We should have those back in the next 2 weeks. Every one of those patients are essentially asymptomatic. I've got one that's on maybe a 25% pain level left. Okay. But overall, he's like back to yoga. He's only dealing with issues when he's basically getting in and out of the car for any length of time, 20, 30 minutes. And so that's kind of, I'm scratching my head a little bit there, but the neurology was clear, life is clear. So this is just a really, really rough, pretty severe spine case.
So you got 3 cases that are coming to the end where they're getting better, and you're going to take a follow-up MRI.
Yes, sir.
We just had, you remember Dr. Gatterman?
I do remember Dr. Gatterman. Hey, Dr. Gatterman.
Hey, he was a guest on episode 9, and him and I are doing some clinical studies that we're going to be publishing in research journals about pre and post. We'd like to include yours in a group setting for these tables.
I would love it. I would love to contribute.
Because as we've talked about, man, this table, it works, but people say they don't work, it's harmful, and we're just trying to get more validation to the amazing technology that we have at our fingertips.
Correct.
Yeah.
Correct.
Hey,
Doc, cool. I have a question.
You have a question for me?
I have a question for the host, if that's okay.
Go ahead.
So, and this is just pure curiosity. I know that you had had an opportunity to maybe speak with a spine surgeon recently.
Mm-hmm.
Did you have that conversation?
I did not. Okay. No.
Okay. Well, I'd love to hear about that in a future podcast. If I can't be on it, I'd love to listen to that, if that's okay.
That's funny. Yeah, we had Dr. Teams here was referring. We had a medical doctor and I had shared a mutual patient. I wanted them to do decompression. The doctor wanted to do surgery. We were going to set up a phone call, and it didn't happen.
Oh, that's too bad.
Yeah. But I will have that conversation, and I will fill you in on the next episode that we do together.
I love it.
Good question. Can we get you back on for a follow-up?
I would love a follow-up, but can I ask one more question?
You can ask one more question.
I heard that after you heard I was getting another table, that you had to get another table.
Great question. I wanted to save this for episode 11.
Then I'll.
It's okay.
Are you sure? Cast that in a bag.
We have expanded into our decompression center. We call it Decompville. It's the community where we help people with decompression. And we have 6 tables. It got a little crazy yesterday in the clinic where people were waiting. I hate when patients run late. So we decided to get a 7th table. So 6 weeks, we'll have a 7th table.
Congratulations. That's awesome.
Thank you. Just more people to help, just like you.
More people to help.
Yeah. Thank you for allowing me the platform to announce that.
Well, you're welcome. Sorry if I let the cat out of the bag a little early. Oh, man.
So we've got 10. We're going to have 10 together.
We do.
We've got the West Coast taken care of. California, Phoenix, Arizona. We got your back
All day long.
all day. Dr. Teams, Russ, thank you. We're going to schedule a follow-up podcast. Do you have any other questions?
No, I just want to say thank you so much for having me on here. I love to be able to share what we do with other people because I feel like, you're really leading the charge here, and it's nice to be part of a movement here with saving people from surgery, spine surgeries, and things like that. So I appreciate you reaching out all the way in the beginning on that table.
Thank you. I appreciate you and all the conversations we've had, and we're just trying to help people through non-surgical spinal decompression.
That's it.
That's it. Well, this is Dr. Teams. You can find him at Desert Brain and Spine. Do you have an Instagram, anything like that they can follow you? What's that?
Facebook, Instagram, Desert Brain and Spine. I think it's all one word. I don't even know. I don't do the postings.
Is there space there? Or?
I don't know.
No.
I don't know. What's my phone right now, or else I'd look.
JC's telling me no space.
No space.
No space. So follow him on Instagram. If you're in the area, contact his office. I want to thank him for being a guest.
My pleasure.
He's going to put the hat on, decomp all day. And this is episode 10 with Back at It with Dr. Decompression. Thanks for listening.
All right. Thanks.
Bye.
Bye.